All right, so this visual should help with the hip extension on that Keiser standing hip machine. Get my thingy pulled up here. So this is a little different in that the lower leg here won't be in this exact position throughout the entirety of the motion, and this only goes from straight up and down to back. So you're going to be starting kind of more, if you see my cursor here, kind of up and forward in a position of hip flexion to begin the motion. But what I want to illustrate here is the arc around which this is moving. So if we draw on this really quick, what you'll notice is it's not just, do it in red so you know it's wrong, it is not just straight back that you're trying to go, especially when your femur kind of starts up here. Oops. When your femur kind of starts up in this position with your tibia down on it like this. It's not just straight back, especially not all the way from here. That's not what we want. Oops, wrong direction. Not like that. What we want is a continuous series of moving around the arc. So at first that's here, and then as your femur gets down more into this position, with your lower leg kind of down here, now we've got more of a kind of a little bit down, but also a little bit more back. And then as you get back into this position where it is in the picture, it's more straight back. And then if you get back beyond your body, let's say your femur is back kind of like this, with your lower leg in this example kind of straight back here, then you're actually pushing almost a little bit up and back. So if you can see, we kind of have this arc of motion that we try to move around. Now let's see if it'll play for me. So you can kind of see that that moves in that arc of motion, kind of always pushing perpendicular to whatever position your leg is in. And if it continued all the way up to the beginning where I drew these little suckers on here, then you would be able to see that it's more of a down at first. One of the main things I want you to focus on here is that this section up here, your pelvis, does not move even a little bit. Most of the time, what people will do is they will kind of be trying to perform this movement, and as they perform it, they'll arch back like this, so their pelvis is moving around. You want to lock that in place as you slowly push your femur back around that arc as far as you might be able to make it. You may never make it back as far as this visual shows, but the important thing is that this section up here is never moving. It's always locked in place, nice and solid, staying in one location the whole time. Okay, they make it move a little bit, which is dumb, but just trying to keep that super locked in, thinking about this arc of motion around here, and that should help you get a better contraction out of your glutes here, because that's what we're really trying to focus on, is getting these to perform the movement. You may feel some hamstringy type stuff, but we want to mainly try to get your glutes to work. So really thinking about that pad that's pushing on you back here and driving back into that, keeping a fixed pelvis. Almost, it sometimes helps to slightly try to push your pelvis forward, or if you're using the straps that I've shown you, then you can actually push forward into that, just to make sure that it doesn't go backwards, is part of the reason that that's there. But if you're not using that, just make sure you're kind of bracing it forward and then driving your leg back on top of your pelvis that does not move whatsoever.